Most people infected with dengue do not develop any symptoms. In the 25% of people who do become unwell, symptoms start about 5 to 8 days after being infected, often with a sudden onset of fever up to 40 degrees Celsius, severe headache, pain behind the eyes, muscle and joint pains, and a generalised redness of the skin which looks a bit like sunburn. Some patients feel nauseous, vomit and have tummy pain. The fever continues for about 5 to 6 days, and around day 3 or 4 of the illness, a skin rash can develop, characterised by red, sometimes slightly raised spots. Symptoms usually settle within a few days of this rash developing, although some patients do experience more prolonged fatigue. During the recovery phase, patients may also find that their skin peels, similar to the peeling you can see following sunburn. Some people do become severely unwell with dengue. These complications are usually seen in people living in endemic areas, in particular young children and older adults with comorbidities, for example diabetes or kidney disease. Complications are very rare in travellers. This is because severe dengue does not occur with the first dengue infection, but rather on subsequent reinfections with a different serotype of the dengue virus. Recurrent infections are much more likely to be seen in people living in endemic countries who are constantly exposed to mosquitoes throughout the rainy seasons, rather than in short-term travellers. Patients who go on to develop severe dengue start to show symptoms and signs about day 3 or 4 of their illness. Warning signs include mucosal bleeding, severe tummy pain, persistent vomiting, fluid accumulation and liver enlargement. Severe dengue is characterised by bleeding and multi-organ failure, and in some cases, particularly in children, it can lead to death. However, with good medical supportive care, deaths from severe dengue are usually less than 1%.